Hi everyone, welcome to week 2 of your EBP course. Welcome back. All right, thanks for the great discussion during the week 1 discussion questions. I love all the topics that were addressed. It was really fun for me. I do just want to bring up 2 points. Most of you really added to the conversation with your posts and did a great job. A few of you on a couple posts just agreed with the writer, but really didn't add any new information or a new perspective. So please be cautious about this at the graduate level for substantive posts. We just need you to keep building and adding, not just agreeing. Second, just a reminder, if you're paraphrasing material from a source, simply citing it and including a reference is great. But remember, if you're taking wording directly from a source, even if it's just like a critical phrase, you do need to place it in quotation marks, and then your citation needs to have the page number or paragraph number, okay? So just a few reminders on that. All right, on to this week. So we do have 3 objectives for this week. Analyze current practice versus research to determine if a change is needed. Assess stakeholders, team roles, and leadership skills needed to bring about the change. Create evidence-based practice changes which are aligned to measure outcomes. And I think really between our discussion questions and the 2 papers that we'll be due at the end of the week, we will definitely be meeting these objectives. This is a really heavy week. So let's start with the discussion questions. Okay, number 1, the first one really kind of makes you put your cards on the table and makes you commit to a direction. You will be posting your initial PICO question in the main forum, the first discussion question, by Saturday night, midnight Phoenix time. And it would be really great if that was your final PICO question, you got it right the first time. But it will likely need a little bit of revision. No worries, you're not supposed to be experts at this quite yet. So based on the feedback that you get from your classmates, because you're probably going to get some really good feedback, based on that and the feedback that I give you, you'll be able to revise your PICO questions a little bit because you'll be submitting them at the end of the week in a paper. I find that sometimes the hardest thing with getting the PICO questions right is getting your question narrowed down enough to something that really you can find evidence about. It's not so broad that you're not going to be able to find studies. That's usually the most common error that I see students making. All right. One note of caution. When you're formulating a PICO for EBP, as opposed to a PICO question to perform research, the comparison or C component will always be the current practice. So you'll not be comparing whether or not one new practice is better than another new practice. You'll be saying, is this new practice more effective than our current situation? Because if you were comparing one new thing to another new thing, you'd be like having a research question. You're just trying the best thing to replace what we're currently doing that doesn't work. I hope that makes sense. Question number 2 starts asking you to think intentionally about analyzing evidence in your new soon role as a master's prepared nurse. So just kind of starting to think about, how am I going to incorporate that? You will be surprised once you become a master's prepared nurse and people find out about that. You might be asked to serve on committees, be part of projects. So you've got to think intentionally about what that's going to be like. So that's our second discussion question. All right. This video is going to be probably our longest one, because we've got 2 written assignments that I want to share some information with you about. Please bear with me. I'll try to shorten the remaining ones. Okay, so as I mentioned in my first video, you will be working on parts of your EB proposal each week, and in the end, you're going to combine all those different sections to create one product. So this week, we have Section A and Section B. As these are components of a larger proposal, you don't need to write them like with an introductory paragraph and a conclusion paragraph, because this is going to be part of an ongoing document. So you will need a title page and a reference page. Also, I need you to be really careful about the word limits for each section. A master's prepared nurse, one of the outcomes of the master's program is that you will communicate in a professional, clear, and concise manner. You are writing a proposal, not a book, right? And this is much more about technically writing as opposed to creative writing. So our language is not flowery, it's very precise and succinct. So that's what we're going to be looking at. Okay, let's get into the nitty-gritty. Assignment 1 is about assessing the real setting that you would like to implement this practice change. You've got to, maybe it's where you work, where you're doing your practicum, where you used to work, but it's got to be a real place, okay? So to assess the organization's culture and readiness for EBP, you need to use an assessment tool. So there is one in the appendix of your textbook. There's an example there that you can use, or you can find another assessment tool in the literature for readiness for EBP. You're certainly welcome to do that. You don't need to include the actual tool as part of the paper. You won't be submitting the tool with how many, where do I think this question was answered, and that question, that raw data you won't be submitting. You will be including items requested in the directions. So you're going to be including like an overview of the results, and you're going to focus on areas that scored particularly high or particularly low on this readiness assessment. You will also need to write about barriers and facilitators of EBP in that facility, and how the organization is or needs to integrate a spirit of clinical inquiry. How are they, or should they be, encouraging people to ask why, to ask, is this the best way? Could we be doing it better? That spirit of clinical inquiry. Okay. Remember, though, you only have 250 words, so please let me know if you have any questions about that. You're giving me a summary. All right. The second paper really narrows down your area of focus for this EBP project. So this one is about the problem you're addressing with your EBP. There needs to be a specific precipitating issue, either a specific problem or a general problem that we're seeing. We're not just changing things for no reason, right? There had to be some reason why people have looked at this area. So I want to briefly discuss something that sometimes students get confused on. Purpose, PICO, and objectives. They all tie together, and you need to discuss all of them in your paper, okay? So let's just start with PICO, okay? Sometimes you will just have the PICO and not the T, depending on your particular project. Okay, so here's an example. Does using antibiotic impregnated discs with central line dressing changes decrease the rate of central line infections among inpatients being treated for cancer? Okay, so that's our PICO question. Does using that little disc with inpatients with cancer decrease the CLABSI rate? Okay, so then your purpose would be to find a practice that will decrease the CLABSI rate in this population, right? That's the reason why. But then the outcome or outcomes get more specific, such as the CLABSI rate among this population will decrease by 5% within 6 months after implementation. So how do you come up with that? So at first, depending on how much you read, you might just have to take a guess. This is initially what I think the outcome is going to be. As you read and read more on this topic, you'll be able to determine what is reasonable to think an outcome might be. So out of these studies that you're looking at about CLABSIs in the oncology inpatient population, how far were they able to decrease their CLABSI rate? Then you can come up with something that would be realistic and based on evidence. So you're going to do a best guess for this paper, depending on how much you have read about the topic already. Okay? All right. Please send me a note if you have any questions about that. And I will also give you feedback about that outcome or outcomes within your paper. Okay? All right. So in this paper, you will also address who cares and who else thinks this is a problem. These statements need to be backed up by references. Okay? And finally, your initial reference list, which is basically a list of format of references that you found, articles that you found about studies or whatever, they can be placed in an appendix after the reference page. So you don't need to use up your valuable words. You'll just be discussing them in general. You can put the actual articles or topics, the references, in an appendix. Okay? All right. If you're having trouble finding resources or conducting your search, if you go to the GCU Library webpage, there is a tab at the top that says Library Services, and underneath is a drop-down menu, and you can click on Ask a Librarian. Okay? Then you fill out a form, and you can either ask a question or you can request to have a time to speak actually with a librarian and brainstorm on search strategies and things that you can do. So some of my students have found that really helpful. And then at the bottom of the directions for this assignment, there is a little attachment about search strategies also. So that might be useful for you. Okay, finally, and we're going to wrap this up, let's briefly talk about formatting. So for each paper, you'll have the title page, the body of the paper, the reference page or pages, and then maybe an appendix if you're going to put your initial reference list there. The use of headings, especially for the second paper, would be greatly appreciated by me. I really want to find the things that I'm scoring and need to give you feedback on. Also, I am attaching GCU's APA 6th edition style guide in case you have misplaced yours. And this will help you with setting up your paper, formatting your references, that sort of thing. And finally, just really carefully read the directions and look at the rubric, especially the top box score of the rubric, because that's what exactly I'm going to be using to score your papers and giving you feedback about. Okay, I will do my best to give you quality feedback, and you will then hopefully incorporate that feedback into your final proposal when you're going to pull all of these pieces together in your final product. So, this video has gotten quite long. I apologize, but I really wanted you to have that information. I wish you the best of luck. Send me questions that you have, and I'll see you in the main forum.